Work on the Catheterisation Lab began back in May, and while it's not quite ready yet, it is expected to be officially inaugurated next month. The Minister for Health and Care, Gemma Arias-Vasquez, paid a visit and spoke to the newly recruited staff, as well as providing an update on its progress to the Cardiac Association.
The idea is to have a system here where if you have an issue, you can come straight up if it's needed. The initial plan is to run an in-hours service and then extend it to a 24-hour service eventually. But if you have an issue and you go to A&E presenting with an issue, you can just literally in the same hospital be seen to immediately.
And as government, how important was it to have this here on the Rock for people to be able to be seen as soon as they are now?
This is one of our manifesto commitments. It's a big deal. We are talking all the time about repatriating services, and this is one of the key milestones, I think, that we said that we'd have a cath lab here. We've promised the Cardiac Association that we'd have a cath lab in Gibraltar, and actually it's one of the services that the population actually use significantly. So for us, it's extremely important to have it here.
The association said they had been lobbying for this for some time and were over the moon.
I think it gives us a lot of peace of mind, specifically since, unfortunately, because of the COVID pandemic, it brought it home that a lot of patients were having to go across to Spain completely on their own, to be taken somewhere into a foreign country where you're actually going to have done medical interventions is not pleasant. Being able to do it at your doorstep where your family you're going to see in the next 15-20 minutes after it's been done, what more can you ask for?
The new lab will be available for a range of procedures.
The kit that we've got can be used for emergencies. So in essence, if people have heart attacks, it can be used for emergencies, but it can also be used for routine work and for prevention as well. So that's why we're so pleased with this kit, because we're going to start slowly, and we'll see the first patient in mid-November, and then we'll build up.
The machine is impressive up close, and staff have been well trained, as consultant cardiologist Dr. Roger Moore told us.
So we've been very lucky in what we've got, really, in that we've managed to sort of bring in a whole lot of people who are highly experienced in this role. Nobody, both in the nursing side, and we have cardiac techs who run all the sort of hemodynamics, that's about blood pressure and ECG monitoring during these processes. All of those have had lengthy UK experience in the labs. And we have radiographers who run all the X-ray equipment. All of those have extensive experience, mainly in central London in teaching hospitals. So there is both myself, who've obviously 20 years doing the process, and all the staff are highly experienced before starting. This is not, we will then be looking to train local people to try and fulfill these roles, to provide some sustainability as we go forward. But for the moment, everybody is fully trained, UK trained, who will be taking part in the team.
The Catheterisation Lab is expected to welcome its first users next month.